I know at the moment everybody's talking about this junior doctor contract, but actually everybody realises it's not just a junior doctor contract. This is just the first step in the way to actually affect every single other person who works in the NHS.
Every sector is going to be under threat because of the proposals, so GPs, primary care, as well as us in hospital.
A lot of the allied health professionals, so nurses, physios, very supportive. Also, when we've been out in the public, we've also had GPs or the doctors come up, have been very supportive, and consultants as well. So it does feel good to feel that we are being supported and we're not just alone.
I know lots of general practitioners, and they're supportive of what we're doing. So they know that this is a problem that will affect the NHS as a whole, not just junior doctors. It's very important. It's very important that you, as in from other doctors or from the public, it's important for us that we know that people understand what we're doing, that we have solidarity amongst the medical fraternity and the public at large. So that helps us to spurs us on to carry on doing what we're doing.
Hopefully we can show that you can make a difference by sticking together, and I think you can show that the proposals that the government are offering are not what's right for the NHS for the future.
Despite all the cuts in terms of striking, we've had a lot of people coming up to us to talk about how they fully back a system which aims to deliver safe working conditions for doctors and for the patients. So yeah.
It kind of gives an idea of how integral the NHS is to the way we live in the UK. And I think it's fantastic that someone who had a heart attack in the community is brought into hospital, gets emergency treatment any hour of the day, and then a couple of days later goes home. And there isn't a penny to pay for that individual. There's such whole-rounded care. We try to provide whole-rounded care, and all of that is just available to anybody in the UK. And I think to lose something like that would impact upon the public, upon British society hugely.
I've spoken to one person all day who had negative, was negative at the beginning. I spoke to him for quite a while, and we left the conversation quite happy. And he understood where we were coming from. Perhaps wasn't converted, but the overwhelming feeling has been support on the ground and from the public.
I think there's already a crisis in terms of retention and recruitment of staff in many specialties. Now I'm from New Zealand myself. A lot of my friends are going to New Zealand, or the ones that have come here are going back to New Zealand. So I think this contract will most likely negatively affect recruitment and retention of doctors. I think this contract will probably make things worse.
These are cuts, and I think people are starting to be more aware of the amount of strain that the health system is going to come under, and therefore the fact that it's not going to be viable to continue with it if we proceed with these plans.